Good morning, good afternoon, everybody, and welcome to this webinar. My name is Sam Clark. I'm the head of programs with Transaid, and I'm pleased to tell you that we have a wide range of speakers today from the project team, from Transaid, from the Canada Fund for Local Initiatives at the Canadian High Commission in South Africa, who are funding this program, and also our implementing partners at SANTACO Women's Desk. Our plan today is to present to you for the next 30 minutes and then leave 10 or 15 minutes for questions after that. So please do send questions through in the chat function as and when they come to you, and we'll do our best to answer all of those. One thing just before I hand over is, could I ask everybody to mute themselves and if possible turn off your videos just from a point of view of saving bandwidth? That would be fantastic. That's to the audience, not to the speakers. Thank you very much. So without further ado, I'm going to invite Michelle from the Canada Fund for Local Initiatives to say a few opening words. Over to you, Michelle.
Thank you, Sam. Good day. Greetings to all partners in development and project stakeholders. Thank you so much for this opportunity to open today's discussion. It's really a pleasure to join you. Safe, reliable public transport is more than a convenience. It's a lifeline to education, employment, and essential services. Yet, as we know, for many women living in the peripheral areas in South Africa, traveling by minibus taxi can come with real concerns about harassment and safety. When women do not feel safe moving through public spaces, their opportunities and participation are inevitably limited. This project is supported by the Canada Fund for Local Initiatives, or CFLI, which is managed by the High Commission of Canada in South Africa. CFLI is a global program of the Government of Canada that supports small, high-impact, and locally driven initiatives with thematic priorities focusing on, amongst others, inclusive governance and democracy, gender equality, peace and security, economic rights, and human dignity. Here in South Africa, we are proud to partner with organizations that turn these priorities into practical action. And we have an excellent example of this with the Transaid project that we will be reviewing today. What stands out about this particular project is that rather than imposing solutions from the outside, the project was implemented through consultation, co-design, and collaboration, resulting in a number of taxi associations adopting the Safe Taxi Charter. It is also really encouraging to note the willingness of industry stakeholders in what is traditionally a male-dominated sector to engage constructively on issues of sexual and gender-based violence. These are not small achievements. They reflect leadership, courage, and recognition by all project stakeholders that safer public transport benefits everyone. This project also reminds us that addressing sexual and gender-based violence requires cooperation between civil society, industry leaders, and government. It is through this kind of partnership that meaningful progress becomes possible. On behalf of CFLI and the High Commission of Canada in South Africa, I would like to commend Transaid and all project partners involved for the excellent results achieved through this initiative. And we look forward to hearing more about the outcomes and impacts of the project during the session. Let's continue to work together towards safe and inclusive public transport for women and girls. Thank you.
Thank you very much for those kind words, Michelle. Obviously, your support has been a big driver for us in terms of being able to implement this program. So thank you very much for that. Without further ado, I'm going to ask our controller to move to the next slide, and I'm going to hand over to the Transaid Project Manager, Dennis Simuyuni. Over to you, Dennis.
Thank you so much, Sam, and good afternoon, good morning. I don't know where you're sitting around the world, but yeah, my name is Dennis Simuyuni, who is a project manager for the Safe Taxi project. So first of all, I would want to just talk about Transaid. So Transaid is a UK charity that was founded by Save the Children, together with the Chartered Institute of Logistics and Transport. And our patron is Her Royal Highness, the Princess Royal Anne. So basically our mission as Transaid is transform lives through safe, available, and sustainable, transport. So our work generally is in Sub-Saharan Africa. As you can see on the map there, those are the countries that either we have worked in or we still have projects that are running right now. So our work, we work normally through collaboration with communities in areas where we are implementing, collaborations with governments, regional bodies, and other local partners to implement projects in road safety programs. And our aim ultimately is to reduce preventable deaths in the following focus area where we are implementing these projects. So we are implementing projects, professional driving training. We are also doing projects public transport safety, transport management, two and three-wheeler safety. So basically, those are the areas where we are working. Next slide, please. So the context of this project is that this project aims to benefit the women users of public transport, especially in cities. For example, in this case, this project we're implementing it in Cape Town. As you are aware, women in these areas solely or predominantly depend on public transport to access, economic and social, opportunities, such as, education, seeking employment, or either, doing their daily chores. They actually depend on this transport. Therefore, safe access to transport plays a very critical role in the development or the sustainability of these communities. So based on the issues that were brought forth by the women in these communities when we did our pilot project, as an organization, we decided to come up with a project to tackle some of the challenges that were highlighted by the women in these areas, especially those that are living in the peripherals of the town. So frequently there are reports in these middle class or rather working class neighborhood where we have quite a good number of reports coming out of high levels of crime, violence, harassment, and so on and so forth. So to make sure that we tackle this, we had to design a project that looked at ways in which we could try and intervene to make sure that we try and answer to the core of some of these challenges that have been highlighted. So if you can see from my presentation here, between 2017 and 2022, 1,553 deaths were recorded, which is a very significant number. And mostly this was associated in the taxi industry. And some of the reasons why these violent acts or deaths occurred was because of the tough wars that exist in the industry. This industry is highly competitive, and sometimes, some of the operators do not adhere to, the rules, where, they end up operating in areas that are not designated for them. hence, causing all this violence that, happens there. The other side of the coin is that, there are no really other affordable alternative means of transport, especially for people that are living in, these areas, such as the trains, which are in some cases non-functional, which were servicing these areas to make sure that people are transported. So because of that, there has been these tough wars that have resulted into deaths, and these deaths have sometimes resulted in women of the spouses of the operators joining the industry. And most of these areas that are affected are Western Cape, Gauteng, and KwaZulu-Natal. And women being, what they are very vulnerable to this sexual, harassment, physical assault, and, particularly when they are traveling alone, which affects them so much. So at this point, I'll hand over to my colleague, Sharon, who is going to take us to the other next slide. Sharon is the chair lead, as she said, for SANTACO Women's Desk. Over to you, Sharon.
Hi, good afternoon. My name is Sharon Petrus. I'm the chairperson of SANTACO Women's Desk in Western Cape, Cape Town. As SANTACO Women's Desk, we are a wing of the Northern Region Taxi Council. And the Women's Desk was formed to ensure that women take their rightful place and share in the profits that is presented to the previous disadvantaged groups. Northern Region Executive consists of 8 women who's running a structure of 251 women. And within Northern Region, we advocate for empowerment of women to improve across the business opportunities and financial resources in a male-dominant industry. We also respond to concerns raised by women and operators and commuters around personal safety. The Northern Region Women's Desk Executive has been spearheading projects, activities in the Northern Region with Transaid. SANTACO Northern Region consists of 20 associations. Out of the 20, we had 9 associations participating in the rollout of the Safe Taxi Charter. Our appeal for more support to reach other associations and beyond to roll out this project. Next slide, please. Our partnership with Transaid started in 2019. It was a study with 3 countries. So it was Abuja, Cape Town, and Tunis. So it was since 2019 until 2022. So in Cape Town, we prioritize the safety when using public transport. We have taxi violence since from 2021 until 2023. And in this violence, majority of our women lost their husbands in a violent manner. And the numbers of women grown in the taxi industry because now they had to take the lead as the husbands has passed on. Transaid partnership with SANTACO Women's Desk, this was to design a pilot for safety in the taxi industry. The projects that we have done and the basic business management that we've done with Transaid was mechanical principles, driving philosophy, customer care, road signs, vehicle inspections, first aid, and the pilot for the safety taxi charter since 2019 and 2023. We also looked at women's rights and GBV awareness. We also had a Blue Dot that we run in Western Cape. It was an initiative, it was also a pilot, and it was also looking at behavior of drivers. Drivers that are speeding, drivers that are overloading, and drivers that's operating off route. So with the Blue Dot system, there was like 5 stars that you had to reach per day. Once you've reached all your 5 stars, an incentive will be paid out to the operator. And the driver that must stay within the kilometers that is allocated. So the vehicles was branded and there was a tracker placed into the vehicles. And from that, every day we had an operating room where you can check on your driver, see where are they driving, are they off route, are they speeding, are they braking. So for Transaid on our side, we have appealed that this project roll out and ensure that we can have the, out of the 9, the other from the 20, we want to empower them and other parties to participate in Transaid. Thank you very much. Handing over to Dennis.
Thank you so much, Sharon. So I'll talk about the implementation of the Safe Taxi Charter. So basically, I'll start by just giving you an overview of what a taxi charter is. This is just a document that we designed, which kind of reinforces the code of conduct for the operators, to remind them, or rather to make sure that they stick to their obligation of being able to provide safer transport, to the commuters. So generally, the taxi charter, was to encourage the operators, to also help, the commuters where they have issues. For example, our women folks were complaining about personal safety. So it was basically to bring them on board, to support this activity, and also, to make sure that they really understand that this was going to benefit them in the long run also, because more people, if they feel safer to be on the buses, means more business for them. So the taxi charter, basically had, has, the rights. It lists the rights of the passengers, the obligations of the operators, and also it provides a platform where contact numbers for different associations, are displayed. And whenever a customer or a commuter has a problem, they could simply reach out to that number and call, either for a service-related problem or a GBV, where we were also provided a number, a national toll line, the hotline number for national GBV reports. So that was the Safe Taxi Charter that I was trying to describe. But the actual rollout of the project started by, us, developing, designing the project, which involved, first we had to design the charter and the stickers. And this was done in consultation with all the key stakeholders, including, the commuters and the operators. So what we did was, after we designed a draft, we went through or back to the, we went through the different ranks that were, participating in this project, to get their views, or rather, if they felt that there was anything that needed to be changed and so on, and to make sure that they were comfortable with what we were presenting. We also had co-design workshops where we had several meetings with stakeholders, that is SANTACO Women's Desk, the general leadership of SANTACO, and operators, and like I've said, also commuters. So that process helped us to design the charter and also the stickers. So on the stickers, generally my colleague Yolandi will come and give you, just to show you an example of how the stickers are, and also maybe just a few words about how they operate. We were operating them. But basically the stickers had a QR code where a customer, if they had a complaint, or if they wanted to access more resources, could just click using their mobile phone to link them to other resources relevant to the project activities that we were implementing. So the second stage was for us to secure buy-in from the operators. Like I've said, we had meetings and engagements with them to make sure that they understand what we are planning to do and or the benefit that what was going to culminate into. Then the third activity was we now started conducting sensitization on the drivers and their assistants, that the sliding door operators, to give them messages, or rather to orient them to GBV or sexual and gender-based violence issues, because we realized that some of them behave the way they behaved because they, in some cases, do not even actually understand what constitutes GBV and what doesn't. So we had to take this initiative through a partnership with Sonke Gender Justice, who are a vibrant civil society organization which specializes in GBV training, HIV, and other thematic areas. So through our partnership with Sonke, we were able to provide sensitization to the drivers and also the sliding door operators. So after the first, the training, we also did an enhanced training that was provided now to the champions to give them more skills on how to handle with these issues and also be focal point persons in their respective taxi ranks. Then we distributed stickers in the buses for those that were operating and participating in the project across the 9 associations that we conducted these activities. Then lastly, just to check on progress or the impact of our activities, we conducted a survey in all the 9 minibus taxi ranks where we are operating, and we got feedback generally, which was positive, which I'll talk about in the next slide. So for now, I'll pass over to my colleague Yolandi, who is the secretary for SANTACO Women's Desk. Yolandi, over to you.
Good day. I'm Yolandi Gordon, and I'm the secretary of the SANTACO Women's Desk in the northern region of Western Cape. The Safe Minibus Taxi Charter was created in partnership with female minibus taxi users and women operators through the SANTACO Women's Desk. It outlines the passenger expectations of public transport providers and the provider's commitment to fulfilling those expectations. It also details procedures for passengers to report issues, either directly to the associations or to the specialist support organizations. Can we go to the next slide, please? The stickers are placed on every participating vehicle alongside the charter as designed to grab people's attention. The QR code that is showing on the stickers connects commuters to the digital copies of the charter and provides information on how to report incidents. We are 9 associations participated in this rollout, where myself and Sharon were mainly involved. This is just a drop in the ocean, and we need more on board to spread to all areas. And in all participating minibus taxis will display interior stickers containing key messages. Can we go to the next slide, please? The information about reporting procedures and the QR code can take you to all the relevant key people that you need. Scanning the QR code grants passengers access to the charter and it provides contact numbers for reporting incidents. After the system is operational, field officers were presented on the site and motivating commuters to engage with the charter and gain further insight into the initiative. This is just a visible sign of commitment to safety from us and to improve the means of reporting incidents. Even though the focus point of this project is women, we do not exclude the safety of our children and men in our society. Thank you. Over to Dennis again.
Thank you so much, Yolandi. Basically, like I said, we had 9 associations that participated in this our project, the rollout of the Safe Taxi Charter. And the 9 associations have a combined fleet of over 1,000 minibus taxis, but we were able to roll out or put stickers and Safe Taxi Charters in 491 taxis across the 9 associations. So, like I said, we had sensitization that was conducted by Sonke. These were specialized kinds of training tailored to the minibus taxi industry, to disseminate information on sexual and gender-based violence, so that these issues can be understood. So we conducted training, first sensitization training, which was a mass meeting where we had 124 minibus taxi drivers and sliding door operators and rank coordinators and other cadres that are found within the taxi ranks attend this training to receive this specialized kind of training. So based on that, we decided to conduct an enhanced training which supported about 23 participants, which were drawn from different associations. And the idea here was to provide them with more skills for them to be able to execute the function of champions in their respective associations. So these were further given training, and their role basically was to be coordinators, or rather focal point persons in the taxi ranks, where our commuters, if they are faced with any challenges, could be able to go there to them, contact them for support. And these people would then, channel these problems or concerns to the relevant authorities within the associations or through the established government departments that are dealing with either GBV or any other cases that relate to, the concerns that have been raised. Yeah. So, it was very interesting that generally what came out from the from this training was that 86% of the drivers after the training showed willingness to help end GBV related violence in the taxi industry. So just to mention also that our partner Sonke Gender Justice conducted pre and post assessment activity to just assess knowledge retention between when the project, their project activities started, when they were doing trainings, and after. So those numbers that came out from there, from the pre and the post, were very, very encouraging, because they could clearly show that there was retention of knowledge and also appreciation of certain vices that were done wrongly previously. And our drivers, were willing also to indicate that they were willing and more confident to go and share this information with their, friends that did not have an opportunity to actually join these trainings. As we said, we are 20 associations, but due to budget, constraint or rather limitation in terms of finances, we were only able to roll out to 9 associations out of the 20. But just to indicate also here that there is still a lot of demand from within the associations that we covered, and also beyond, Northern Cape, Northern region, to the bordering, regions around Western Cape. Next slide. So, like I said, we conducted a survey just to look at to check whether we are getting the expected impact. So we conducted a survey, and we administered a questionnaire, and 1,162 commuters took part, both male and female. And one of the second biggest concern, still was reflecting that there was concern around the crime and personal safety. And of that group, 96% of the female commuters indicated supporting that it was a good idea for us to have the safe taxi charter in place, because they felt that it was very helpful. And 94% of the women actually indicated that they were willing, or rather they were happy to recommend the use of this charter to other users of the taxi, of the minibus taxis. So based on what we have said, there are other results that for the sake of time we are not able to share here, but those that are interested can get in touch with us. We could be able to post these results later on, or we could share individually. But generally speaking, there has been a very positive feedback from various stakeholders. Like I said, more taxi associations were willing to join, but due to constraints, we were only restricted to a certain number of operators. But our appeal now is to all potential funders that are here and that will listen to this webinar later on, to say that this initiative is a proven scalable initiative, and there's a lot of appetite. And as a project, we are appealing that if funds are available, we can roll out this initiative to other regions within Western Cape and beyond South Africa, beyond Western Cape, in the whole lot of South Africa, and even beyond. So for now, all I can appeal is that please, when you have time, look at this webinar, which my colleague Sam will post on a website, so that you can probably go through again, to just in case there are issues that we could not have elaborated very well here. Next slide, please. So this lady that you can see there is Shirley Cleopas. She's one of the members of the SANTACO Women's Desk, very vibrant woman. She's a rank manager at Belleville. She's also a mother and a wife, and one of the keen supporters of this project. So I'll leave you with this video, a short video of Shirley, so that you can just get a glimpse of her daily life as an operator and a driver in the minibus taxi industry in South Africa. My colleague Sam will share a longer version of the video, which you can access on our YouTube channel. Please bear with us. The volume is slightly lower on this, so please try and pay attention. So as I hand over to Edward, please, are you able to share the video?
Hi, I'm Shirley Cleophas. I'm 54 years old. I'm a taxi driver. I've been driving taxi now for 17 years. I'm an ambassador for SANTACO Women's Desk. I do customers' complaints and I do regulating. The complaints that I normally get from women is drivers that's harassing them, guards that's using foul language towards them, guards that's pulling them out of the vehicle whenever they tell the driver not to drive that fast. It's stuff like that that make the commuter feel very unsafe. Even I had an incident where one of the guards stabbed a customer in the taxi. The support we get is from Transaid. I had about 5 courses of the GBV. training. We have stickers in the vehicles and the charter safe taxi in the vehicles where they can do the reports to whomever is on that list. It gave us amazing results. I would love for other associations to also sign up with Transaid. They can just benefit from it. I want to encourage women to be more powerful. You don't need to be shut out by the world, and tell them who you really are, what you want, and what you want to become.
Thank you so much.
Thank you, Dennis, and thank you everybody on the presentation team for that presentation. And now is the time. We're running slightly behind time, but we'll try and fit in a few questions. And any questions we don't get the chance to answer, we'll answer separately. Absolutely, we'll come back to you. So I have a few questions in the chat, and I've also been sent a few questions by other means. Yolandi, I want to go. You touched on an answer from the first question that we received, which was when speaking to drivers and sliding door operators about gender-based violence and the project, what tends to be their initial reactions? I know you sort of you did type in an answer, but I wonder if you could elaborate, because I think we go into this sort of industry feeling, obviously it's very male dominated. We perhaps come to the assumption that there is maybe resistance to learning about these sorts of subjects, about welcoming women into this industry. But maybe, Yolandi, you could elaborate a little bit more on your answer to that question.
Thank you, Sam. Yes, for example, as we heard what Shirley said about courts using foul language towards women, you know, I've experienced a few, mostly men. They know about GBV, but they don't exactly know what all it entails. So for them to use foul language, they never thought this is harassment or this is something wrong, this is GBV. So that is one of the things amongst a few other things. That's why I said the response from them was in a way a bit shocking. Oh, I do this and I never knew it's part of GBV. So that is what I meant with they don't exactly all know what it entails. Thank you.
Thank you, Yolandi. The next question is, how transferable are the learnings and processes that we used as part of this project to other towns and cities across South Africa? And I wonder if I could ask that question to Dennis, if that's all right. You've already touched on this, Dennis, a little bit in your previous presentation.
Yes, thank you so much, Sam. Well, what I can say is this is a scalable approach because generally speaking, the taxi industry broadly within South Africa operates in the same kind of format. You understand? So these issues of violence are not just confined to Western Cape, but they are, generally spread across. And the way the associations operate and the culture of the people are similar. So it is very easy to replicate this approach, this initiative in other places in South Africa. Just to say it's very easy because also we have documented, all the issues concerning the project. There's a lot of learning. Based on, the lessons learned from this project, it would be easy to replicate this project anywhere else. Also drawing some lessons from, the database that we have created to draw on, what solutions we can provide to different kind of challenges that we may face as we try to roll out. Thank you so much. I hope I've answered your question, Sam.
Thank you, Dennis. It wasn't my question, but yes, you did very well. Thank you. The next question is, are there any tangible plans in place as yet to scale up the project and implement in other areas of South Africa? The short answer to that question is our plans to scale up this initiative do depend to a certain extent on securing additional finance. But from Transaid's perspective, this relationship with SANTACO Women is incredibly important to us. It's been going on now since, I think, 2017. And during that time, we have not forgotten the need to try and sort of seek external funding, seek external support to expand on the projects, because there are so many other projects that we'd like to implement with SANTACO Women's Desk as well. I want to just push on sort of an addition to that question and ask you something, Sharon, which might justify the scalability of this particular initiative else to other parts of the country. But what, in your opinion, what sort of appetite is there from other associations to join this initiative? To you, Sharon.
Hi, thank you, everyone. With the project that we've done now since 2019, it's almost 6 years. The awareness is there, and what we have done some training, advanced training, whereby we have now ambassadors that is currently operating on the ranks. And then we also trained champions on the ranks. So from the association side, there is a more positive reaction, especially when it comes to complaints and implementing the project and the GBV awareness that's out there. But we are still busy with the challenge whereby we have to get more training, empower, bring more awareness out. But from association side, we have engaged on the ranks to the regions, and it's quite a sensitive topic when it comes to GBV. But for the rollout to all the other areas and the regions, even beyond, gender-based violence has to come to a point where the action is taken, and the awareness should be more, and to ensure that especially when it comes to spouses and even the male, even though the industry is male dominant, even to bring the male back to his childhood and ensure, because we also have to look into the past as to how they were reared and what is their background, and that is all resources and training that we will need in collaboration with stakeholders and especially with Transaid. And as chairperson of SANTACO Women's Desk, I have experience at this project for this year, 6 years, and the passion is out there. It's just for us as the industry, because in the taxi industry, anytime violence can erupt. We can't say it won't happen at any time. So we are actually in fear, and we need GBV to be widely spread and ensure everyone knows what is GBV. Our ambassadors on the rank are doing to the best of their ability, trying to interject, and from the ambassadors it goes to the training officer, and then from there go to the chairperson, and then there is also disciplinary hearings that we are doing to ensure when complaints do come in that the customer or the commuter is the first priority, as they are the people that's ensuring that we have a livelihood. As you know, in Western Cape and everywhere else, employment is high, and this industry has given us an opportunity to become businesswomen. And with losing our husbands, at this time, we as women have to stand in that position and ensure that our girls are protected, and that we put a platform there out for them, and to make sure that they are protected in all spheres of any department when it comes to harassment, and ensure also that all women are protected with their rights, and they can start a business for themselves. Thank you.
Thank you, Sharon. You've touched on a few answers to some of the other questions as well. Thank you for doing that. Just to elaborate a little bit and touch on what Sharon just said, SANTACO Women's Desk is a nationwide initiative. So the potential for rollout is absolutely there, and obviously this project places SANTACO Women's Desk at the forefront of this initiative. And I know from speaking to Sharon, speaking to Yolandi, and many of their colleagues that there is appetite to lead and design and roll out this initiative, not least to the other 11 associations within the Northern Cape region of Western Cape. But also, Northern region is only one of, am I right, Sharon, 7 or 8 regions in Western Cape province?
Hi, Sam, and everyone. In Western Cape, we have 8 regions within
8
the
regions.
province. Yes,
Right.
so currently we are now only with Northern region, and we have to ensure that we get all the 7 outstanding regions to form part of this project. Thank you.
Brilliant. So there's a lot of scope to expand to the other 7 regions within Western Cape province and then nationwide. Though I think the one challenge that SANTACO Women's Desk would communicate is that as things stand, there's no sort of budgetary allocation to the group. Something which I know they're working on and working to improve, which does limit the rollout of projects such as this, which is why I think there's to some extent a reliance on the support of external donors and so forth. We have come to time. I know there's 1 or 2 outstanding questions which we will respond to separately, but I'd like to take this opportunity to first of all thank the presentation team. It's been a pleasure working with you not only on this webinar but also on the project. Thank you to Michelle for your support from the Canada High Commission, and also thank you to the audience for listening to the webinar today. Thanks everyone, and have a wonderful rest of the day.